Stephen.
And I'm Elizabeth Cook. The governor called it a sober reality check. KPIX 5's Andria Borba on what still looks like what could be a long wait for a COVID vaccine. Andria?
Well, Elizabeth, we could see some vaccines this year here in 2020, but chances are you are not on that priority list. A dose of reality today from California Governor Gavin Newsom about a COVID-19 vaccine. It may not be widely available until the third quarter of 2021. Pfizer and Moderna are now anticipating 45 million doses nationwide by year's end, but California won't get them all.
That on the high end for a state like ours, it's $1.5 million, 2 million people tops. And we have roughly that many people just in our healthcare delivery system.
He's talking about the healthcare workers who will get first priority, along with public safety employees and the elderly. Dr. Art Reingold from UC Berkeley helped author the national priority list.
The problem is that, those numbers add up to a very large number of people and a very large number of doses. And realistically, we're not going to have enough doses of vaccine for everyone who should have it until well into the next year.
In addition to that, California and New York will be running their own data to make sure the vaccines are safe, which Reingold says could give people a bit more peace of mind about their efficacy.
I think if it helps reassure people that this has been looked at and that we really do know that it's a safe and effective vaccine, then I think that's a reasonable step to take.
Remember the concern early on in the pandemic over PPE? Governor Newsom worries about a new run on supplies, as both the Pfizer and Moderna vaccines will require storage below 7 degrees Celsius.
Don't think that dry ice won't be a commodity of concern and consideration as it relates to our vaccination strategies.
Now, Andria, do we know if the vaccine is going to be a single shot, or will you have to get multiple doses of it?
Well, one of the vaccines that is in late-stage clinical trials right now, Elizabeth, is in fact a two-step process where you get one shot and then 21 days later you will get a second booster shot of that same COVID-19 vaccine. If that is the case, those 45 million doses, they're cut in half.
Wow. Okay. All right, Andria, thank you.